After chloramphenicol, the second class of drugs that also act on the 50S subunit of the ribosomes and thus inhibit protein synthesis are macrolides. They are as well bacteriostatic in nature, but at high concentration, they can also act as a bactericidal agent. Macrolides at high pH are very active and thus can penetrate abscesses and can be used when abscesses cannot be drained. At low pH, they are degraded, that is, in the stomach. The first of the macrolides, that is erythromycin, was obtained from the bacteria Streptomyces erythraeus and thus can be associated with hypersensitivity reactions. The drugs included in this class will all have thromycin in their names. They are erythromycin, azithromycin, roxithromycin, and clarithromycin. We'll discuss some of their important properties separately. Among all of them, erythromycin is acid labile and it is thus given in enteric coated tablets and has a food interaction as well, while all of the others are acid stable. Azithromycin also has a food interaction and oral administration should be either 1 hour before or 2 hours after food. Clarithromycin's GI absorption is also good but undergoes first pass metabolism. Coming back to erythromycin, its prostatic concentration is very high and thus can be used in the treatment of prostatitis. Azithromycin's intracellular concentration is very high, so it can be used against Mycobacterium avium complex. Roxithromycin's intracellular concentration is not that good. Its uses will be same as erythromycin, while clarithromycin's intracellular concentration is also very high and thus can be used for the same cause as azithromycin. Some points regarding the pharmacokinetics of erythromycin are that it does not cross the blood-brain barrier, is metabolized in the liver and excreted in the bile. Its oral bioavailability is low because it is acid labile and has a short duration of action. Coming to the antibacterial spectrum of macrolides, erythromycin has a narrow spectrum of activity and is active against gram-positive cocci such as strep pyogenes and strep pneumoniae, gram-negative cocci such as Neisseria gonorrhoeae, and Clostridium perfringens, diphtheria and listeria gram-positive rods, also Wallace mycoplasma, Legionella, C. trachomatis, and Bordetella pertussis, but not effective against Bacteroides fragilis. Roxithromycin is almost similar to erythromycin, while clarithromycin and azithromycin reach high concentration intracellularly and is effective against MAC complex, also against H. pylori, Toxoplasmosis gondii, and Salmonella and malaria for azithromycin. Now for some unwanted effects, erythromycin and clarithromycin are enzyme inhibitors, okay? So they will have drug interactions with the number of drugs such as theophylline, carbamazepine, valproate, warfarin, etc. and they will increase their plasma concentration and thus their effects. The erythromycin and clarithromycin are also associated with the side effect that is fatal ventricular arrhythmias when they interact with drugs such as cisapride and estimizole. For the side effects of erythromycin, it causes enteral toxicity because it stimulates the mortallin receptors of the gut. Now, mortallin receptors are peptide receptors in the gut that are responsible for gut contractility. So, by stimulating that, it will cause diarrhea and nausea, vomiting, and epigastric pain. It can also cause hypersensitivity reactions because I already mentioned that it is derived from Streptomyces erythraeus, that is a bacteria, and can cause hypersensitivity reactions, while azithromycin and roxithromycin are rarely associated with drug interactions because they do not inhibit enzymes. Now, we've discussed this spectrum of activity separately, but we'll have a recap while listing their uses. They're considered the drug of choice in Mycoplasma pneumoniae, Legionnaires pneumonia, chlamydial infections, to eliminate the carrier state of diphtheria, and as a drug of choice for treatment as well as prophylaxis of whooping cough caused by Bordetella pertussis. Apart from these uses, macrolides can also be used in cases where patients are allergic to penicillin and thus can be used to eliminate the Clostridium tetani, and also some streptococcal infections, that are skin and soft tissue infections such as cellulitis, pharyngitis, tonsillitis, etc. And also they're used prophylactically before surgery and also to eliminate rheumatic fever occurrences. Lastly, we have ketolides that are derivatives of macrolides, that is erythromycin, and the drug that we'll discuss is telithromycin. Now, one thing that you need to remember is that it will be effective against those organisms which are resistant to macrolides and also for community acquired pneumonia. A limiting side effect of ketolides is their hepatotoxicity. That's all about macrolides.